Hi, my name's Patty, and I'm going to be your nurse today. How are you doing today?
Good.
Good. I need to do a head-to-toe assessment on you. This won't take very long, okay? Is that okay that we get started with that?
Yep.
Okay. First of all, can you start by giving me your first, your last name, and your date of birth?
Krista Spencer, September 19th, 1997.
Okay. And this I would check against her chart just to make sure that the information matched. Okay, thank you. Do you have any allergies?
Nope.
That you're aware of? No medications, no seasonal allergies, nothing like that? Okay, excellent, good. All right. I'm going to ask you a couple of questions, just bear with me, silly questions. Do you know what today's date is?
November 20th,
Okay, and what's the year?
2015.
Okay, and do you know where you're at right now?
Petoskey at the McLaren Hospital.
Okay, thank you very much. Okay, are you having any pain anywheres?
Nope.
Okay, good. All right. At this point, I'm doing the math, and she's 18 years old. I'm assessing her, and she looks her age of 18. She's good hygiene, good, appears to be healthy, good weight. Can you verify information that I have on your chart as to your height and your weight?
I am 5'4" and around 130.
Okay, good. Which is, yes, it is a good height and weight, and she's healthy. All right. At this point, I would take her vital signs, and I'm just going to kind of simulate that. I would check pulses, and I would check them for a full 30 seconds. And then I would immediately go into checking respirations. And then for this simulation, I'm going to end up with a pulse rate of 68 and respiration rate of 16. Okay? I would then check a blood pressure, and I would make sure I had the proper size cuff, position it on the arm in the proper position, have her relax her arm. This, again, I'm just going to simulate, but we're going to have a nice, wonderful blood pressure of 112/78. And then we would also check a temperature. And temp is a perfect 98.6. Okay. I'm going to be checking your head here next. And I'm just going to be kind of feeling around and feeling for any abnormal lumps or bumps or any abrasions. And I don't see anything, nor do I feel anything. Okay. I'm going to be checking sinuses. And I'm going to feel sinuses there and sinuses there. Any tenderness, any kind of pressure in these areas?
No.
Okay. And I'm going to feel the temporal artery. That's nice and strong, a 2+. Okay. I'm going to go down to TMJ. I'm going to check that. Okay, would you go ahead and can you open your mouth, close your mouth, open your mouth about halfway, and go side to side with your tongue. Good? Perfect. Okay, good. All right. I want you to, can you scrunch your face up? Good. Okay. Can you smile for me? Okay. Good. Can you raise your eyebrows? Okay. And can you close your eyes? Just nice and gentle. And good. All right. Okay, everything there looked good. All right. I'm going to move on to your eyes now. And I would put gloves to examine the eyes a little closer, so I'm going to do that. And I just want to take a look at the outsides of the eyes and kind of pull back just a little bit. Everything looks good. The sclera is nice and white. I don't see any abnormal redness or any swelling, no signs of infection. Everything looks good there. I'm going to check the reaction of the pupils. So I need you to just look right straight ahead at me, okay? Okay. Pupils nice and reactive, perfect. Okay, I need you to take, it doesn't matter which one you want to start with, cover one of your eyes.
Oh gosh, okay.
Yep, okay. And I just need you to follow my finger with your eye. Good, perfect. And then swap. Okay, good. All right, and then I just want you again to follow my finger, and we're going to check the field of gaze. Wonderful. Now we would also check for the red light reflex, but I don't have an otoscope with me, so if we were to simulate that, I would look into the eye and look for the red glow, but we'll just have to simulate that. I'm going to move on now to the ears, okay, and I'll start on each side, and I'm just going to palpate the ears, look at them, make sure that they look normal. I'm also going to check behind and around. Everything there looks good. Okay. I'm going to take a nice look inside the ears. Nice and clean, no signs of redness, infection, no wax buildup, everything there looks good. Same over here. Wonderful. Okay. I'm going to do a whisper test now. I'm just going to whisper a word on each side, and then I want you to just repeat the word back to me, okay?
Blue. Yellow.
Okay, perfect. Okay, we're going to go to nose now, nose and mouth. Nose is symmetrical, appears to be patent. We're going to do a sniff test. I need you to just, block one side and then take a deep breath in. Good. And then opposite. Okay, good. No congestion. Going to move on to lips. Lips are fine. They're moist. No crustiness or cracked or anything like that. Take a look here both at the nose, which I don't see any redness. Again, no crustiness. The mouth, go ahead and open. Can you say ah for me and stick out your tongue?
Ah.
Okay. All right. Soft palate looks good. Teeth look good. Gums are nice and pink. Mucous membranes are nice and moist. Tongue is completely midline. All right, thank you. Neck. Just want to feel around your neck. Feel some lymph nodes. Everything feels normal, no enlarged lymph nodes. Going to listen to her carotids. Good, 2+ sound. Good. I'm going to check her trachea, which is nice and symmetrical. It's completely midline. And then I'm going to check her range of motion. Can you look to your right? And look to your left. Okay? And look back to your right. And I just want you to kind of push against my hand there a little bit. And then look to your left. Good range of motion and good strength. Okay, I'm going to move on to upper extremities. Okay, I'm going to take a look at her arms. And I'm just, again, looking for any bumps, bruises, scrapes, anything abnormal, which I don't see. All right. And then I want to do a range of motion with this arm. So can we go straight up and down, and up halfway and out. Good. And then twist your wrists. Okay, good. Go to this arm here. Again, same thing. Looking at the arm. No bumps or bruises. Nothing like that to document. Range of motion. Out. Any issues with any of this movement? Anything uncomfortable?
Nope.
All right. Okay, I'm going to check your radial pulses. Nice and strong, 2+. I want you to squeeze my hands. Good. Nice and even pressure. My patient has fingernail polish on, but we'll pretend that she doesn't, and I'm going to do a capillary refill, which is very quick. So less than 2 seconds for capillary refill. Okay. Okay, we're going to assess the posterior lungs and thorax. And I'm standing behind the patient. Normally we would expose the back and the skin. For my patient, for this purpose, I'm going to just kind of pretend that that's being done. So at this point I would assess the transverse diameter, which is a ratio of 2 to 1. I would assess the skin, looking for any lumps, bumps, bruises, or abrasions. I'm going to ask my patient to take a nice deep breath in. Okay, and exhale. Okay, all of that is completely equal and symmetrical. There was no use of any of the accessory muscles. I'm going to now perform the tactile fremitus. I'm going to listen to a series of spots on your back. Every time I move my hand, I would like you to repeat the phrase 99. Okay? First one.
99.
Good.
99. 99. 99. 99. 99. 99. 99.
Okay, good vibrations, equal throughout. I'm now going to listen to her lungs. Nice deep breath. And exhale. Good. Again, please. And one more. Lungs were clear, equal bilaterally, and there was no wheezes or crackles. I'm going to now feel the costovertebral area. Any tenderness?
Nope.
Okay. Okay, I'm going to move around to the anterior, and I'm going to start by palpating the axillary muscles. Can you go ahead and put your arms up to the side for me? I think I said axillary muscles, but it's axillary lymph nodes. Okay, everything there feels normal and good. I'm going to move on to the supra and the infraclavicular nodes. Okay, those all feel fine. I'm going to assess the chest. Again, looking for any abnormalities. Everything there looks good. Are you experiencing any tenderness?
No.
Okay, good. And I'm going to listen to the lungs, anterior. Okay, nice deep breath. Okay. Oops. Good. Everything sounds good. Okay, next I'm going to add. Okay, with the patient laying down now, we're going to move on to the heart, and I'm going to inspect the pericardium. And I'm going to find the apical pulse, which is the left fifth intercostal space. And then I want to listen to the apical pulse. And I'm also going to listen at the apex, the mitral, the tricuspid, the pulmonic, and the aortic. Going to move on now to the abdomen. And again, I'm going to inspect for any lesions, any irritation, any edema. I want to listen for bowel sounds in all four quadrants. Bowel sounds are present in all four quadrants. And I'm going to kind of palpate the quadrants. Any tenderness?
Nope.
Okay. And I'm going to percuss the abdomen. And I want to percuss the liver borders. I'm going to check for the femoral pulses, which are down here, and also for the inguinal nodes. Everything there feels fine. Okay. And then I'd like to assess the lower extremities. Again, normal patients in the hospital or even in a doctor's office would have an examination gown on. So I have legs exposed. Again, I would examine the skin looking for bumps, bruises, abrasions, anything like that, any abnormalities. And I'd look those all over. And then from there we would move on to some range of motion. So we'll start with this leg, and we're going to do a knee to chest motion. Good. And the other leg. Okay. Go back to this one, and we'll do an out to the side. Okay. Move down the foot, and we'll do a flexes, dorsiflexion. Any discomfort with any of these? Okay. All right, and then I have you lift, bend at the knee here. I would check behind the knee for popliteal pulses. Sometimes these are hard to obtain. In this case, the use of a Doppler would be effective. And I would check both of them. Okay, good. And then go ahead and put your legs back out. I would check pulses in the feet, the DP, and the PT on both. Usually in younger people, these are easily palpable. Sometimes in older people or those with PVD, again, the Doppler would be used. I would also do a skin assessment of the feet, checking the heels, make sure that there was no breakdown of the heels, bottom of the foot, ball of the foot, and capillary reflex of the toes. And then one more assessment. Okay, I would like you to step on like a gas pedal, push toward my hands, good, and toes toward your nose. Okay, good strength. I'm also going to put a hand here. I want you to push against my hand and try to lift your leg. Okay, good. And other one. Excellent. Good strength. Okay. You can go ahead and sit up if you can. All right. So now we want to check doing a couple of neuro tests. So I would like you to take one hand at a time and do finger to thumb, each one. Perfect. Other side. Okay, great. And then I would like you to close your eyes for me. Just put your hands in your lap. I'm going to touch one of your fingers, okay? And whatever finger I touch, I would like you to touch your nose with, okay? Excellent. Good. Okay, you can open your eyes now. And I want to check your supination and pronation. Can you stretch your arms out in front of you? Good. Okay, next we would move on to reflexes. So I do not have a mallet, so we will pretend that this is my mallet. And we would check reflexes at the bicep, at the radial, and also at the tricep on both sides. Okay? Then we would move on to the patellar, okay, just below the knee. Okay, and then I have one more, the Achilles. Can you stand for this part? And I need you to position yourself so that your knee is kind of up on the seat there. Okay, I'm going to hold your foot. Okay. Each side. Okay, can we switch legs? Okay, same thing. Okay, thank you. And, okay, stay standing for me. Next thing I want you to do is I just want you to stand, okay? And I'm just at this point going to be assessing your spine, okay? And I want to check range of motion. So can you go side to side, front to back? Good. All right. And I'm going to kind of switch positions. And I want you to walk toward me. Okay, good. This examination and assessing of the gait would also be done at the same time as doing the Snell test for vision. Okay, and I want you to turn around and walk back. And with this, we would be looking for any instability, any limp, any foot dragging, anything like that. And then I have one more test to do. Is I'd like you to just stand, relax, close your eyes, okay, and just remain still. Which she remains perfectly still. This is the Romberg test, and we're looking for any sway to denote any neurological imbalances. But everything here looks good. That's the end of our assessment.